My client has had foot pain for many, many years. Always worked on his feet as a carpenter. And foot pain got worse, especially on the left side, about 3 years ago. And in October of, was it 17 or 18? You had the surgery?
18.
Of 18. You had an implant here to reduce the hyperpronation of the left foot. And the implant caused a lot of pain, and so it had to be removed in December. And we are now towards the end of February of 19, and you're still limping, you still have a lot of pain, and you note that you walk more on the outside of the foot, can't stand on that foot. Limping is very obvious, and it's a very rigid foot. It has good up and down motion, so the ankle joint has good dorsiflexion and plantar flexion. The right ankle and subtalar joint has good rotational mobility. So this is movement in the transverse plane. I can rotate it left and right. And I can evert, pushing the heel outward with good motion. And I can also invert it. It's not a lot of motion, it's how you're made at the factory, but you have motion. On the left side, I'm trying to do that twist in the transverse plane and there's no give. And I'm trying to twist it medially and there is so little motion, absolutely rigid and limited. And coming underneath the fibula on the right side, I can create some superior spring. It's a very small amount of motion, but it's normal physiological movement. And the same thing with a posterior pushing towards the floor on the lateral malleolus. So the lateral malleolus here is swollen and you can see the surgical scar. And I come underneath this, underneath this fibula, and it definitely has a hard swelling around it. And there's no upward mobility. It's poorly defined because of the swelling. And if I capture the front of it and I try and spring it backwards, there's no movement. And if I try and evert the heel, pushing the heel outward, there's no movement. And if I try and invert it, there's no movement either. So we have a very rigid subtalar joint. And if we come and test cuboid motion, there's no upward or downward motion through the cuboid. And then if we capture the midfoot and test midfoot pronation, there's no movement. I'm trying hard, I'm pushing passively with a reasonable amount of force, trying to get that foot to fall down, the arch to fall. On the right side, we can capture that midfoot and induce some rotation and get that arch to drop a little bit. So we certainly have, a significant problem of mobility, and I don't know if we can help it or not, but we need to find out if we can. And certainly a cane would be helpful for his walking, so we'll have him get one this afternoon. And there's a question of orthotics, and orthotics aren't going to do anything on a rigid foot. But we will work really hard and see if we can gain some motion here. And he's not able to stand on that leg. He's not able to do heel raises. And it seems like he had some nerve damage even before the surgery, but it seemed to have gotten worse with heel raises after the surgery. So I'll stop filming here and we'll get to work.